Moscowitz here. Thanks for joining me, everyone. My guest is Dr. Stephen F. Hotze. He is the founder and CEO of the Hotze Health and Wellness Center in Houston, Texas, Hotze Vitamins and Hotze Pharmacy. He's an author of several books, the best-selling author of Hormones, Health and Happiness, and Hypothyroidism, Health and Happiness. Dr. Hotze, thanks for joining me this afternoon.
Charles, it's a pleasure to be here, and a warm greeting to you and all your listeners and viewers from Houston, Texas.
Thank you, sir. So, given your background, I want to talk obviously about how to survive and even possibly thrive in the atmosphere we're in now, which is the pandemic. And for starters, you're an expert on supplements and vitamins, which you offer. Now, I think that, again, I'm a layman here. I'm not a doctor. But it seems to me that one of the lessons we can learn from this is that we need to strengthen our immune systems so that if it possibly reduces the likelihood of our contracting this dread disease, but if we do contract it, it improves the likelihood that it's going to be mild and that we're going to get through it. So I have my own vitamin regimen, which includes stem cell ultra product. It's a natural stem cell. It being over 60, that's a good idea, and other things. But I'd like to know from you, what do you recommend? I mean, I know that it's kind of an individualized thing, but what do you recommend?
Well, thank you, Charles. And this is a great point you made, and you're on top of it. The reason I'm so interested in the topic of the coronavirus is because I have Hotze Health and Wellness Center in Houston, which I've had for 30 years. I was trained conventionally as a physician, and it wasn't until 1989 where I made a switch to natural approaches to health. It came after my father had a heart problem, and he had read some newsletters, one from a Dr. Whitaker, who was a natural approach doctor out in California. I read the newsletter, and he said, "Well, what do you think about what he said, son?" And I said, "Well, Dad, I wish we'd have tried this." He said, "Well, I need to take vitamins. What do I need to take?" And I went, "Dad," it was like a deer in headlights. I'm a doctor. What do I need? Vitamins? That's terrible to admit that, but that's a terrible situation.
Well, they don't teach it in medical school, right?
Yeah, they don't teach you in medical school about good nutrition and how important that is for your health, and how vitamin and minerals are important for your health, because they're basically subsidized by drug companies. That's another conversation. So as I was watching TV on the coronavirus when it first came out, all I was hearing was, wash your hands, don't touch your face, don't shake hands, don't touch dirty doorknobs, stay away from people, social distance, don't crowds bigger in town. I'm going like, that's not building anybody up. You got to have a healthy immune system. And when I built the Hotze Health and Wellness Center, it was built with the goal for each one of our guests, a twofold goal. One is to strengthen your immune system, and two, increase your energy level. If you have a healthy immune system, you're not going to get recurrently sick. You're not infections. If you have energy, your organs are going to work, and your mind's going to work, your heart, everything's going to work optimally when you have good energy. So I built my whole practice around, and with our providers here, we have over 65 on staff, and with our providers and with our staff, our goal is to help individuals have energy, vitality, and enthusiasm for life. So I wanted to get this message out, and this is the 54th program I've been on nationwide, and on radio programs all over the country. I was on Fox News on the 15th on Sunday on the coronavirus update, and I said on Fox News what I'm telling you and all your listeners and viewers. You're in charge of your health. Charles, you know that. You're in charge of your health. The government's not in charge of your health. Your insurance company's not in charge of your health. An employer's not in charge of your health. Your spouse is not in charge of your health. You and you alone are in charge of your health. And you can decide if you want to live a healthy lifestyle or not. It's your choice. And if you want to do that, the way you do that is really simple. You start with good eating habits. I want to make it clear so everybody knows all the things that we really love to eat. Down here in Texas, we have Bluebell ice cream. We've got, everybody likes, we've got Shipley's donuts, and we've got breads, pizza, pasta, and cookies and cakes, and all those things people love to eat and eat too much of. Those are all starches, which are sugar molecules hooked together. And when you your mouth, they turn into sugar, and sugar depresses your immune system. You want to depress your immune system, gain weight, have inflammation in your arteries, then eat a lot of grains, corn, potatoes, and rice. And I'm saying that facetiously. You should eliminate those. So you eliminate and decrease the stress on the immune system. So your immune system can be healthy. So your arteries can be healthy and you don't have the inflammation. So you don't gain weight and lose weight. So that's one thing you can do. Eat a healthy lifestyle. And I recommend a keto lifestyle. And that means good oils and good fats like eggs, bacon, butter, avocado, nuts, olive oil, fish oil, coconut oil, hard cheeses, a lot of green vegetables with butter on them, a little meat. That's good. And you can intermittently fast. So that's, I eat once a day. I eat at dinner every night. In the morning, I have bulletproof. That's a cup of coffee with a tablespoon of coconut oil in it and sugar. And that keeps me all day long. I'm not hungry. And I keep body weight. So that's the first thing you can do. It doesn't cost you a thing to do that, but everybody should do that every day as best. Does that mean you're never going to have a cookie or cake or something? No. But overall, you've changed your lifestyle so you eat to live rather than live to eat. Second thing, and this is really important, is your vitamin regimen. Vitamins have been proven to build, strengthen the immune system. And I have a simple program: A, B, C, D, and Z. A, B, C, D, and Z. Vitamins A, B complex, vitamin C in copious large doses, vitamin D in large doses. That's vitamin D3, as a matter of fact, and zinc. So as a matter of fact, Charles, I came up with 3 weeks ago when this started. I started on programs, doing radio programs and telling people that they needed to do A, B, C, D, and Z. And they started calling. Now I've got a vitamin store, so they call. They're buying bottles of this and that. We're running out of things. People are running out of this stuff. It's crazy. People all of a sudden decided to get healthy now when this virus comes around. It's just human nature, you know. We don't get to work until things really get bad. But that's just human nature. So anyway. So I put together an immune pack, and the immune pack has vitamin A in it, 10,000 international units. It's got a good B complex in it, which contains the thiamine, riboflavin, niacin, pantothenic acid. You've got folate, you've got B12, on and on. And the B complex vitamins are in there. Then it's got vitamin C, 6,000 milligrams of vitamin C, and it's got 10,000 international units of D3, and it's got 30 milligrams of zinc. So that's the pack. It's a 30-day pack. You take them morning, you take them in the evening, and you have a 30-day pack, and that will help build up your immune system. And so if anybody's interested, they can go to HotzeVitamins.com and order that. Go around to your store, wherever you are listening, see if they've got those, vitamin A, B, C, D, and zinc. And that's the way you can build up your immune system. The other things that are important that don't cost you a dime is, one, exercise. Jump rope. You don't have to run a marathon. Jump rope, swim, bicycle, do something. You keep yourself active and get a good night's sleep. Those things are all very helpful and will bolster your immune system. Now, you mentioned about stem cells, and we have stem cell exosomes, which are the product that produced by the stem cells that help the body in the cells of the body that are injured and old, rejuvenate, revitalize. It modulates the immune system and cuts down on inflammation. So stem cell exosomes can be helpful too in people that have this problem. Here at our center, we're basically a health and wellness center, so our people are healthy. And you know what they're worried about? I talked to our concierge in the reception room, and she came up. Her name's Becky Diaz, and she goes, "Dr. Hotze, the people here, they're not concerned about the coronavirus. They're concerned about the economy." And so let me talk about that. What we have is a strategy right now in our country. We've created irrational fear. We've created mass hysteria and panic over a virus, an infection, which is real. And in those people that have pre-existing conditions and that are elderly, debilitated, and infirm, it can cause problems and even lead to death. Mind you, 98 or 99% of the people that get the virus, and right now only 1 in 2,000 have contracted the virus in the United States, compared to the flu, which is 1 in 7 this year have had the flu. So we have 1 in 2,000, and of those 1 in 2,000, only 1% will die of this problem.
Right.
Those are people that are elderly. A lot of them, a lot of the people that have died are in nursing homes. And I just know from having been in practice for 40 years and our clinics have seen over 40,000 guests. I know in nursing homes, people, unfortunately, that's where people go when they're really worn out and they're getting very old and the family can't take care of them. They've got dementia, serious illnesses, and they need that round the clock care and can't go in a hospital. But that's where they go. And usually within 2 years, people after being in nursing homes usually die, and they usually die of infections. Very commonly, it's infection that gets them. And that's what we're seeing in this problem. But the rest of us, the overwhelming, 98% of the people are not, it's only 1 in 2,000 are going to contract this. So that's 0.002%. No, that's 1 in 2,000. So that's, anyway, that's a very low percent, obviously, compared to the flu. Mm-hmm. 1 in 6 people. And yet we have an all-out war against the coronavirus. We're shutting down the schools. We're shutting down the churches. We're shutting down all public events. We're shutting down everything and making people quarantine and stay at home. Well, what does this do? This demolishes the economy. I just read on the front page of the Wall Street Journal last week, 6.6 million people applied for unemployment. That's after 3.3 the previous week. That's 10 million. That doesn't count everybody that's lost their job. And this isn't going to get better over the next month when nobody's at work. It's going to get worse. There are going to be hundreds of thousands of bankruptcies, of business and personal bankruptcies. And this is going to come with a tremendous health toll. Stress causes health problems. People that lose their job have an increased mortality rate. So the unintended consequences of trying to protect the elderly and the infirmed by making everybody quit working is I think, an unprovident way to handle the problem. It's like taking a shotgun and shooting at a deer 300 yards away with a shotgun using number 8.
Well, Dr. Hotze, let me just ask you then. First of all, I do think that it's probably appropriate right now to follow CDC guidelines when it comes to social distancing. And now they're talking about masks because it is a particulate transferable disease. And washing hands. I always was a fan of social distancing anyways. I don't think that, I don't think we should be shaking hands so much. It's a custom that might go by the wayside. In Japan,
what they're going to do is turn everybody into a neurotic germaphobe in the country.
No. It's just a matter. I disagree. I think it's just a matter of developing certain customs that protect you, by which you protect yourself, and you get used to that. And there are going to be, and there are going to be some social changes because we are more aware of how diseases spread. And to me, it's as natural to protect yourself from viruses and diseases as it is to protect your property. So I don't think that that's a problem. I'm very uncomfortable with the idea of any kind of mandates. And I think President Trump has been somewhat reasoned and balanced in that he's not doing what the left wants him to do, which is create martial law and seize properties. That's what they want. So I'm grateful. I thank God that he's in the White House right now, because otherwise we would probably could be like Cuba. So, yes. Now, so having said that, I do think that there is benefits to improving your immune system, and I've done that. The kind of stem cell I'm using is all natural. It comes from Lake Klamath, Oregon. It's by this company called Cerule, and also the vitamins which I take every day, along with some other things that are good for the heart. And I have a regimen that I've developed over research from years that deal with specific issues that I have. So I think that one of the other takeaways from this pandemic is that we can improve our, develop a regimen of supplements, and that's where you come in, Dr. Hotze.
Well, this is kind of a foundational for immune system health. there's a lot of other supplements that can be used for other reasons, for heart health. Vitamin C is one of them. By the way, vitamin C is a wonderful, wonderful.
Yes, I take a mega dose every day.
Now, I'm just going to tell you something. Most people, you may know this because you've obviously studied this. Most people are unaware that all the mammals in God's creation, including all the vertebrates, except for humans, monkeys, and guinea pigs, make their own vitamin C, and they make approximately 1,000 milligrams per 25 pounds of body weight. They don't have heart attacks. Why? Because they don't get the inflammation in their arteries. Vitamin C enables your body to make collagen, which heals the inflammation that occurs in the arteries. It also helps prevent the inflammation in the arteries. Vitamin C is very critical. That's why I've always recommended to my guests, our patients, we call guests, to take 1,000 milligrams of vitamin C per 25 pounds of body weight. If you're getting sick, let me just say, I tell them this, if you get maybe your allergies are flaring up, you feel like you're getting sinus or bronchitis, or, maybe the flu-like symptoms, double up on your vitamin C. Take 1 to 2 every hour until you get loose stools, and then back off by 25% the next day. And when a person's sick, their requirements for vitamin C are much higher. And whereas you may take, say, a 200-pound person may take 10 or 12,000 milligrams to give them loose stools. If they're sick, it might take 20,000 before they get loose stools. So that's kind of the barometer that you use to know how much you take when you're sick. You back off from that 25%. So if you got up to 20,000 milligrams and say every 2 hours, and you got loose stool, the next day you would take 15,000, 5,000 in the morning, 5 at noon, 5 in the evening for vitamin C. I'm a big advocate of vitamin C, and they in China and in Singapore and in New York, they use vitamin C, and treating is one of the treatments of the coronavirus. We've used it for the flu for years here. We do IV vitamin C's, and it's very, very helpful. Dr. Tom Levy's written a great book about vitamin C, and it's a wonderful preparation. And I highly encourage your listening audience, and I'm sure you're taking it as well, but vitamin C needs to be a big part of your daily regimen. The other is vitamin D, and use the D. That's the most active ingredient of vitamin D. Of course, vitamin D is made from cholesterol, which is a very helpful molecule, by the way. Cholesterol is a building block of all your sex hormones and your adrenal hormones. It's important for brain function. It's important for neurological function. Every cell has a cholesterol ring around it. It is the building block for vitamin D.
And I think also, if I may interject, it's particularly important for people living in my region, which is up here in Boston,
right?
Because you don't have as much direct sunlight, and in fact, doctors up here actually give you a prescription for vitamin D, which you don't need. You can buy it over the counter.
Absolutely.
But vitamin D is key.
Amazing drug company comes out and patents vitamin D. How do they do that?
Sure. No, that's crazy.
The doctors, instead of telling you to get it in the store, they're making you buy a high-priced vitamin D.
No. You can just buy it at your local pharmacy.
Right. Sure, that's right. Exactly. Yeah. Make sure it's D3. The other thing too, most Americans are working inside. Just don't get enough supply.
Right. Exactly. Yep.
What we find in our patients is we find very low levels and the low range all the time of our guests, the patients that come in. I like to see vitamin D levels above 70 picograms per ml. Between 70 and 100. I take a ton of vitamin D to keep it at about 90. And vitamin D has been shown, vitamin C too, there are thousands of articles in PubMed about the health benefits of these vitamin supplements and their benefit to the immune system. So that's very important. And there's a lot of other vitamins you can take, but that's a good starter. If you want to build up your immune system, vitamin is good too. It's helpful in the immune system, so you could take A, B, C, D, E, and Z. And you'd be in good shape on that. Let me just mention something too. You mentioned about the social distancing, and while I understand that perspective, here's a perspective I have on that, and it has to do with herd immunity. One of the things. Look, every one of us, unbeknownst to most people, since the day we were born, we have been exposed to literally trillions of bacteria and viruses on a daily basis. Our body is full of viruses and bacteria. We call it the virome, has about 600 trillion viruses live in our body. about 100 trillion bacteria. As a matter of fact, if you weigh 200 pounds, you have about 4 or 5 pounds of bacteria in your colon. They staph epidermidis lines our skin, and we've come into a symbiotic relationship with these bacteria, and they help us keep out bad bacteria too. As a matter of fact, when people are exposed to various viruses in the environment, most people don't have any problem with them. It's those people that have severe underlying problems like heart disease and emphysema, diabetes. Diabetes is a big one, because sugar depresses your immune system, and so they have high sugar levels, and they're susceptible. And people that are obese, these are some risk factors that leave people open. But for the average person, they're not going to have any problems with this. 25% will be completely asymptomatic. Another 60% or 65% will have mild to moderate symptoms. That'll be it. I had a friend that had been to Aspen, came back 3 weeks ago, had cough, congestion, a little fever, lasted for 3 days. He's an accountant, got over it, went back to work. Then his friend called him that he's been in Aspen with and said he had been diagnosed with the coronavirus. Mm-hmm. And a parent probably had it too. He never had a test done. When they did the test a week later, it was negative at that point because he got over it. He built up an immunity to it. But if people, with all these things, you get herd immunity. So people come and we come in contact with them, and most people have this one time, and then next season when it shows up, you've already got immunity to it. We've got herd immunity. We don't have a problem with it. You follow that? So there's something to be. One thing I'm rather concerned about is this whole idea of quarantining healthy people so nobody gets the disease, and now they're going to put us back to work. Well, that virus hasn't gone away. Trust me, it's like a fireplace. You burn the fire at night. You go to bed, you wake up, you have ashes. Put your newspaper on top of those ashes. They're going to start on fire because there's...
So let me then interject here. So then, I get what you're saying about building up immunity. In fact, they say that things like peanut disease, allergies, a lot of this stuff is because young kids no longer play in the dirt anymore, and they no longer go out and get exposed to various things that they build up normal immunity to, so that as a result, we're actually more vulnerable. So I get that idea. Having said that, is it appropriate in this time to have some kind of a limited exposure to this virus? For example, especially if you're older, if you're over 60, or if you have a pre-existing condition.
Here's what I think you need to do. You don't want to have a shotgun approach. I think those people that are young and healthy should be at work, and they'll build herd immunity. Nobody's going to die from it. The elderly, what you do is you have a targeted approach. Approach. Those people that have pre-existing conditions, the elderly that are debilitated and infirm, let them sequester. They can sequester themselves. They shouldn't be out in public. The public shouldn't be going to them because you could expose them to a problem. Now, right now, they have everybody at home. So my grandmom and granddad are home with mom and dad, and they're home with the kids, and who knows who's drugged what in there. We're making these people more potentially have a chance of coming in contact. That virus is out there, sir. It's not just a little bit. This virus has probably been here well over a month, maybe even 2 months.
Right.
Even knew about it, and people were coming in with cough, congestion, going to the doctor, and the doctor, you got a little bronchitis or you got the flu. And not everybody gets a blood test for that, or they don't go to the doctor. They just had it, Like my friend, he just had it, and if nobody had told him anything about coronavirus, he'd have thought, well, I just had a little case of the flu, because the symptoms are almost identical. So who knows? But it's probably been out there a long time, and they'll end up doing some serological tests. They'll know that at some point in the future. So I'm just concerned if we say we lay off for another month, and then maybe things flatten out. They say, okay, we're going to go back to work, and we go back to work, and all of a sudden, now the virus has got a whole bunch of new hosts it can go back to, and it flares back up again. What are you going to do? Knock out work for another 2 months again, and destroy the entire economy? No matter.
No, look, if I may interject, I think that what you're saying makes a lot of sense here. And I think that This is how Sweden, for example, is dealing with it. What they've done is that they've sequestered their vulnerable population,
Right.
separated them, people that are elderly or pre-existing condition, and the rest of the country is conducting business as normal. Now, you know, if you have, now you may have cases where someone who's young does get sick and very sick and could die. So yeah, there are risks involved here, and we should note that. However, if someone gets a very mild exposure to it, it doesn't mean they're going to get it, and eventually they do build up, as you say, I think, an immunity to it, which actually, in the broad sense, from a public health standpoint, is the best way to combat this disease.
That's right. Now, they say they're going to come out with a vaccine, but that is not a sure thing. A vaccine is a sure thing. Otherwise, we wouldn't have flu epidemic. You may not be aware of this, but according to the CDC statistics, and you can go to CDC, Center for Disease Control, look up flu. This year's flu, this is their upward estimates that 54 million Americans, that's with an M, have had the flu this year. That's about 1 in 6, 1 in 7. And of that, upwards of 62,000 have died since October 1st. That's 340 every day. And this happens every year. On an average, 50,000 Americans die of the flu every year. We've never shut down buildings. We've never shut down work. We've never banned schools. We've never banned church services or public events because of the flu. We just haven't. We couldn't afford to do it every year. And so we look at that compared to what the coronavirus is. And right now, it doesn't appear to me it's going to get near to the range of what the annual flu does. And then you look at all the causes of death that we have in America. Here's one thing: big public health problem is automobiles. 37 people die every year in automobile accidents. 100 a day. 2.5 million are injured in auto accidents. That's like 6,500 every day. That's a huge public health problem. If we quit driving cars altogether, walk, bicycles, or rode horses, we wouldn't have all these deaths. But at some point, you say in a society, people are going to die. There's a cycle of life. There are certain things that there are certain risks that are going to happen to continue conducting your society, or else everybody's going to roll and go back into a cave, and just go hunt again. So, so when you put it in perspective, there's 600,000 and 650,000 people die of heart disease, 600,000 die of cancer, 85,000 die of diabetes, 47,000 die of suicide. There are multiple causes of death in our society. 7,700 people die every day. Now, a fraction of these people are going to die from the coronavirus. Why have we selected this out to destroy the entire country over this when we could do what Sweden does, is select?
Yeah, no, I think it's a point well taken. And, it really gives me an interesting way to think about this, and the step back from the politics of it and the approach of it, which brings up a whole different ball of wax in terms of why this is happening the way it is. That's something that I've discussed with various guests. But Dr. Hotze, I want you to, because we're reaching the end of the program here, let my listeners and viewers know how they can reach you, how they can get more information about you and your website, et cetera.
Sure. One, if you're interested in building up your immune system, I do offer a Dr. Hotze Immune Pack, 30-day supply, A, B, C, D, and Z, and that's at Hotze Vitamins, Hotze Vitamins.com. If you're interested in learning more about natural approaches to health or getting a copy of one of my books, Charles, I like you. I've enjoyed the interview. I'd be willing to offer a copy of my book, Do a 180 and Join the Wellness Revolution. All they need to do is contact us at HotzeHWC.com is the website. That's HWC, or they can call. What they ought to do is call and leave a word and say, I listened to Dr. Hotze on Charles Moscowitz show, and I'd like a copy of the book, Do a 180 and Take Charge of your health. And that's at 281-698-8698, 281-698-8698. Just tell them you heard me on the show, and we'll send it to you free of charge, and we'll pay for the shipping. And I'd like everyone to get that, because it'll show you how you can take charge of your health, so you don't have to end up, as you get older, you don't end up on a pot full of medication. My daddy told me, hey, Charles, you might appreciate this. When I graduated from medical school in '76, my dad and this was in Houston, held a banquet for me at the Houston Club. And over dinner, he turned to me and said, son, I said, yes, sir. He said, don't poison your patients like all the other doctors do. Do you understand me? And it wasn't a request. It wasn't a suggestion. It was a command. It took me 13 years. That seed took root for 13 years and ultimately gave birth to the Hotze Health and Wellness Center.
Wonderful.
People get off drugs and get their bodies healthy naturally.
Well, I admire your work, and I you're right on the right page here, and I really appreciate you joining me. I'm going to put a link up to this on the YouTube channel, etc. And Dr. Hotze, I want to thank you very much for joining me this afternoon.
It was a pleasure, Charles. Thank you so much. It was a pleasure to be with you.
Thank you.